The American Society of Reproductive Medicine has changed their position for egg freezing. It's still a relatively new technology, but in the last year, the American Society of Reproductive Medicine determined that it was no longer considered experimental. This has allowed virtually all the clinics to offer egg freezing to clients. We're looking to help women, typically under the age of 38, extend their reproductive window by going through an IVF cycle, retrieving eggs, fertilizing those eggs in cases where they want to save embryos, or more commonly, freezing the eggs and allowing them an opportunity to fertilize them at a later date. So when we freeze the egg, it's actually in a contained apparatus which protects it from the liquid nitrogen. Our experience with slow freeze suggests that these eggs may be stable for an indefinite period of time. A lot of the criteria that are used for patients undergoing IVF will be applied to women who are hoping to freeze their eggs. The goal is to identify those patients with a large egg reserve that still have the capacity to produce genetically normal eggs. Most centers are more comfortable freezing eggs for women with a large reserve under the age of 38. We can do simple tests in the clinic to identify whether or not a woman is a candidate based on blood test and a simple ultrasound. Most women lose the ability to produce genetically normal eggs over the age of 43. So if a woman plans on starting her family anytime after the age of 43, she would have to use a donor egg. These new technologies of egg freezing are hoping to allow women to preserve their eggs in their 20s or early 30s, and if they choose, they can reproduce similar to men at virtually any age over the age of 43.